So I've gathered this impromptu gang at the end of the Who Shoes workshop in Staffordshire because they've all come up and said quite nice things, and I thought, well, somehow perhaps to capture a little bit of that energy. So I've got all these wonderful people. Anna's used to this. So Anna, start by telling us what you've been doing today.
I have been creating this record behind, and I have to say there have been masses of post-it notes, but the quality of them it feels like I got a real sense there were some really deep and meaningful conversations happening, really sensitive topics being discussed, and written and recorded in a really respectful way. So that makes my job much easier.
It was a special event, wasn't it? Because we go to a lot of different events. This was a special event. And Molly came up to me and she's just the real deal, a young person that wants real co-production. And
yeah, well, when I first came to this event, I didn't really know what to expect.
Who does?
Yeah, I'd heard a little bit about it. I knew it was about a board game, but then when I started playing the board game, I realised it was about so much more. I realised that this is what true co-production is and means and happens in practice. I've learnt so much just from this short session. Jill has been absolutely brilliant. She's given me so many tips already.
I'll give you some more.
Yes, yeah, keep that coming.
I love it.
Yeah, made loads of networking opportunities and just can't wait to keep going on this journey through co-production in the NHS in general and wider,
And wider, and you will do. So, yay! So, and then these people came.
So I think we had a really useful day, didn't we, talking about things that are quite challenging at times.
Yeah.
It's been really useful as someone who I suppose leads a team of practitioners but isn't a practitioner myself to hear it from both sides as well, to see about what we get right but also what we can do a bit better as well.
And it's been fab to hear you explain how the cogs are working in the background for the services and what's actually happening. It's very easy to get frustrated as a parent, not at the actual services, but sometimes at the length of wait times and why that can be, and how when you move from one part of the service to another, it's been great to have that pulled apart to understand more so that I can then give that information to other parents. And I said a massive thank you to Jill as well, because this has been really, really positive to be a part of, so thank you so much for bringing me. It's given me a lot of hope and a lot of faith that change is coming and how things are going to move forward. Luckily we're at the tail end now. My daughter's had a diagnosis, but it's been years in the making, and the frustration, seeing how much it's affected my daughter, and also as her parent, the frustration and the pain and the anguish has been awful. And now to see this happening and to know that change is coming and it is going to be a much more fluid, collective system that's going to be there to support, as I was saying, God forbid if my daughter decides to have children herself, there's going to be greater service in the future there than what we currently have now. So it gives me a lot of hope, and thanks.
Yeah, I love that word hope, and it's such a shame that Yvonne Hope isn't here today. So I want to give a mention to Yvonne. Yeah, we will. Yeah, and she's been so influential in this. And I know that you love her, don't you, Rach?
Yeah, that's what I was saying. Jill and Yvonne, they're my heroes. But I have to say today, I think I've gained a new hero as well, because we had a young person on our table that was absolutely inspirational and so insightful. So I know there's professionals in the room that are linked with that particular young person. So I'm gonna follow that up and see, can we utilise the amazing insight that she has to help other young people, to
Passion and drive she's got
to give that peer support.
Yeah. Isn't that brilliant? So I don't, I don't get to sit around the tables, but I know
You've got work to do.
I know, but I know that there are conversations that are happening with different, with people with different perspectives. But what you've between you have just described is exactly that. Those different perspectives as a parent, as someone who's used services, as someone that is responsible for providing services, and being able just to get your head around those different perspectives.
We were pulling apart generational trauma at one point, and how we've been able to see that going back and moving forward, and how she's trying to break those chains now moving, and with her own issues as well. what a phenomenal young woman.
And to be able to have that time to have those conversations,
Yes, exactly.
you just don't get that opportunity, do you? And
That's why this
that's
is
what this
really
does.
important.
To
Really
get
important.
those young people into the
Yes.
room, and we're going to let Molly loose with the copy of Whose Shoes.
I can't wait.
But you can't plan this stuff in advance, it's just who comes along and what conversations you have. So thank you for that.
Thank you.
Impromptu. All right, come